Which of the following is not a risk factor for infertility in men? A. Moderate cigarette smoking. B. Frequent spa use. C. Untreated chlamydia. D. Major hernia surgery. E. Mild sun exposure. The answer is E. Mild sun exposure. Cigarette smoking and other poor lifestyle choices have been shown to cause decreased fertility in men. Surgeries such as hernia repair could also have a negative effect on male fertility. Sexually transmitted infection can cause fertility problems, especially if left untreated, in males and females. Frequent hot tub or spa use has also not recommended. Mild levels of sun exposure are the least likely of the above to cause infertility in men. The nurse is educating a 19-year-old female on contraceptive methods. The nurse describes which of these as the most effective? A. The male condom. B. Fertility awareness. C. Withdrawal before ejaculation. D. The female condom. E. A diaphragm and spermicide. The answer is A. The male condom. The male condom is the most effective when used correctly. However, if used incorrectly, carries a much higher risk of failure. The male condom is also the only method of the answer choices that also carries protection against sexually transmitted diseases. The nurse is educating a 23-year-old woman on contraceptive options. She describes which of these as the most effective? A. Medroxyprogesterone acetate injection. B. The cervical cap with spermicide. C. Oral contraceptives. D. Etonogestrel/ethinyl estradiol ring. E. Contraceptive patches. The answer is A. Medroxyprogesterone acetate injection. Medroxyprogesterone acetate injection is the most effective of the listed methods. Other methods of the above carry the risk for displacement or incorrect use. The nurse should inform the client that the medroxyprogesterone acetate injection is not effective against sexually transmitted diseases. The nurse is educating families in northern Wisconsin on the subject of tick removal. The nurse knows that teaching has been effective when they state all but which of the following? A. Grab the tick as close to the skin as possible. B. A fine-ended tweezer works best. C. After grasping the tick with the tweezers, twist until removed. D. Use gloves to protect fingers when removing ticks. E. Save the tick in your freezer. The answer is C. After grasping the tick with the tweezers, twist until removed. Never twist, jerk, or rip the tick when attempting to remove them from the skin. Wear gloves or use a paper towel if they are not available. Seal the tick within a plastic bag and keep it in the freezer. If illness occurs, the tick may be useful for further testing. Which of the following is a bacterium frequently responsible for causing urinary tract infections? A. Clostridium botulinum. B. Escherichia coli. C. Candida albicans. D. Mycobacterium leprae. E. Treponema pallidum. The answer is B. Escherichia coli. Escherichia coli is a bacteria that lives in the normal flora of the intestines. However, it is also a frequent cause of urinary tract infections. Candida albicans is a fungus that frequently causes thrush and vaginitis. Mycobacterium leprae is responsible for leprosy or Hansen's disease. Treponema pallidum is a spirochete responsible for syphilis. Lastly, Clostridium botulinum is responsible for botulism as a result of its secretion of a neurotoxin.